3, 2, 1. Welcome inside the WVLT newsroom. I'm Will Puckett. We're getting new details in a Comptroller report out of the Tennessee Comptroller's office on an investigation into the Tennessee Health Facilities Commission. The Comptroller's office is saying that that commission failed to investigate thousands of complaints against nursing homes and other healthcare facilities in a proper amount of time. We're going to dive into a little bit of that report, some of the graphics and graphs that are in the Comptroller's report on the Tennessee Health Facilities Commission's investigation and just how the Comptroller's office says that they failed to perform important investigations in enough time. So we'll go ahead and show you a couple of graphics here that are inside that Comptroller's report. This specific one that we're looking at right now shows late complaint investigations of nursing home and assisted care living facility complaints based on the complaint level. You can see, according to the Comptroller's office, and this is from 2022 to 2025, so coming just out of the pandemic and then into April of this year, you can see that immediate jeopardy investigations that were started late, 778, and they range from days late to just 3 to almost more than, or just more than 2 years, close to 3 years at 897 days. You can also see that in the medium and high categories, you're stretching into 1,900, almost 2,000 days in the high category, and then medium in about 1,035 at the maximum. That's for nursing homes. And then right there, you can see in assisted care living facilities as well, stretching from immediate jeopardy to 424 of them, all the way to 1,100 in the medium complaint level category. And so this is a look again from the Comptroller's office at just how late some of those investigations came and the complaint level that they classified them as. Immediate jeopardy, you can see 778 in nursing homes and 424 in assisted care living facilities. Another graphic that is listed in this Comptroller's investigation, you can see open surveys by number of months outstanding as of April 17th of 2025. As you look at this graph, assisted care living facilities, 347, 198 of those withstanding were 0 to 15 months. So a year, just more than a year in the assisted care living facilities are outstanding. And then in the nursing homes, you can see 323 in total. That 0 to 15 month category, 131. So not stretching as far off into the distance, but you can still see a year or more withstanding. And so again, this is coming from the Tennessee Comptroller's office investigation into the Tennessee Health Facilities Commission, surveying almost 700 healthcare facilities across the state, late on investigating thousands of complaints across the state of Tennessee. And so again, we have this online for you on WVLT.tv and inside your WVLT News app that is available for you to look into right now. We're just diving into this investigation out of the state Comptroller's office. From 2022, more than 3,000 facilities the commission was tasked with reviewing and investigating complaints every 15 months. So every year and 3 months, they were tasked with investigating 176 nursing home backlog. Some of that was from the COVID-19 pandemic, but still, when they picked those back up in 2022, that backlog increased to 192. You're looking at some 5,534 complaints were uninvestigated in this time frame, again dating back to 2022. You can see right here, this is a look at the web story that we have up for you right now on this, again inside the WVLT.tv webpage on your desktop and then inside the WVLT News app. But very handily, we have a link to the state's audit right here, right when you get into it, and this is on the Comptroller's website. And so this is just a look at getting into that as we can dive into that Comptroller's report for you right now. We're going to go ahead and take this full screen for you just so we can dive into it just a little bit deeper here for you on this Thursday morning. This is going to be about, let's see how many pages this report is in its entirety, about 60 pages. Some of this legal jargon right there to start off, but as you start diving deeper into it, you can see the background. Performed July 2022 oversight of the Health Facilities Commission, shared across multiple state entities, issuing licenses and monitoring for 15 facilities, also assessing penalties against deficient healthcare facilities, maintaining the state's abuse registry, approving a hospital's trauma program and inspecting trauma centers, and managing civil monetary penalties imposed against healthcare facilities. That's just giving you background on what the commission did in its job and what the Comptroller's office is diving into to investigate. And so they outlined that the executive director of the former Health Services and Development Agency appointed to the commission to oversee how these are laid out. And so they're just looking at the timeline from 2022 to pre-July 2022 to July 1st, 2022, all the way to July 1 of 2024. But this is going to look into just exactly what the Comptroller's office says that this commission failed to do in just a more than 3-year time span. You can see just, again, the prior audit findings and what they were diving into as they investigated what they were looking at in these nursing home and assisted living facilities as we continue to dive sort of into all of this. So this is a look at just sort of how much certificate of need laws. So Tennessee does fall into the certificate of need category. You're looking at a handful of states, so this entire central to east portion of the U.S. has that certificate of need. Again, outlining what you're looking at. Handful of facilities no longer needing that requirement. This is just, again, just a handful of information that is within this investigation. And so you're looking right here at Tennessee's federal nursing home completion rank for surveys fell to 32nd in the country, 31 in 2023, almost dead last in 2024, and then did bounce up in 2025. This is looking at all 50 U.S. states, the District of Columbia, and Puerto Rico, of how many people are completing nursing home surveys and getting them back. You can see that Tennessee falls just below the midline in most of the time, and then well below the midline in 2024. So that's just looking. Some of that obviously impacted by the pandemic, some of it just not happening. From July 1, 2022 through April 17th, the commission performed 16,629 complaint investigations, 79% of which were related to nursing homes and assisted care living facilities. Given the number of complaints and vulnerability of the residents, they focused their work on 2 types of facilities. You can see 62% of the complaints come from nursing homes, 17% assisted living facilities, the other 20% classified as other. They say the other category includes facility types with lower complaint volumes, as well as general licensure complaints, just to give you a little bit of context on just what they're looking at in the complaint. So facility survey and complaint investigation process overview, create survey, select survey types, review complaints, conduct on-site survey, identify the deficiencies, and get that back to the facilities so they have actionable items that they can work to improve on. This is the graphic that we showed you a little bit earlier, looking at the open surveys and how long those months were. Again, we showed you the majority of them in the 0 to 15 month span. It said 15 months on the actionable items. We showed you where those investigations were initiated late. We showed you that graphic also. And so we just want to make sure that we highlight some of this for you. And again, you can find that inside your WVLT News app and on the desktop at WVLT.tv is where you can find all of that information. This one is looking at total civil and state monetary penalties that the commission actually assessed and collected from nursing homes from 2023 to 2025. 64 nursing homes penalties assessed. Just a little bit, about a couple of tens of thousands of dollars left. Looks like about 20 facilities did not, or nursing homes did not pay of the assessed penalties and then the collected penalties. And then nursing facilities were just were ahead by about a dozen or so. So just, again, money that was assessed, money that was collected in this audit report. And so we're looking at trying to find the actionable items now. This just outlines the commission's responsibilities. Did the commission comply with statutory requirements? Based on the work, we determined the Commission fulfilled its responsibilities by attending meetings. Audit objective, did the Commission comply with statutory requirements? Based on our review, Commission management sent the Commission's audit report chart to the Comptroller, approved it, so that's just some actionary items. And then looking at what needs to be changed in statutory ruling. Did the Commission develop a plan to address the upcoming changes to the Certificate of Need requirements? They say the Commission is scheduled to review the proposed rules change. And then complaint investigations. Did the Commission management establish a process to ensure staff completed nursing homes? Based on our work, we found they were not completed on time. Did the Commission establish a process to ensure staff begin complaint investigations in due time? They said they found that they're struggling to begin and complete complaint investigations within the required time frame. The backlog does exist, and then also it looks like not able to resolve backlogs of surveys for nursing homes. Management is required by statute to resolve them by 2026 and may challenge to eliminate that backlog by the deadline. So that's a finding there that they say that they need to work on. Again, all of this can be found right now inside your WVLT News app and on the desktop at WVLT.tv. All of those, again, actionary items that the Health Commission can take as they get to looking on how to address some of these issues. Again, this is just a look at the Comptroller's office finding the Tennessee Health Facilities Commission failed to investigate thousands of complaints on time. And so that's just another deep dive into making sure that they assess the issues with the Health Facilities Commission. There are some actionable items. You can see that entire 60-page report right now inside the WVLT News app and on your desktop at WVLT.tv.